The program that I'm working on is creating a curriculum to enable students to implement a health equity focused quality improvement project at a clinic where they are embedded for a 16-week period. Our primary focus is actually equity in quality improvement measures. What we've specifically looked at is a core set of 7 to 8 measures. This includes colon cancer screening rate, cervical cancer screening rates, hypertension control, diabetes control, screening and treatment of mental health disorders such as depression and anxiety, screening for social determinants of health, which is a new QI measure at UNC over the past year, and vaccination rates. What we're looking to improve is equity gaps that exist in these QI measures. And our goal is to have students create sustainable processes. So ideally update something like a clinic standard work so that there is an improved workflow where providers and care partners and future students are conscious of the equity gaps that exist and are actively implementing changes to reduce or close those gaps. And what we're starting to move towards is actually looking at patient data. So my next step, I've now submitted a stats request, is to compare providers that work directly with students on QI projects versus providers that have not worked with students in the same clinic to see if there is a differential in the equity gaps and whether we've been able to succeed in our goal of improving patient equity when students work on projects. This project has taught me a lot about building trust with communities and with patients. The biggest thing that I have learned from participating in this grant has been that in order to be successful in any sort of change, it's really, really important to engage your stakeholders and to get their input. My goal through this project is not just to change patient outcomes and to change patient care, but also to educate students and preceptors about the equity gaps that exist so that they know about them and they're empowered to do something. And during one of our focus groups, we had a preceptor that shared that through her experience working with her students, she now knows how many of her uninsured patients have not had a mammogram. And this is something that she's going to actively work to improve. It's just one story, but I can imagine that if this is something that students are doing at 50 clinics or 40 to 50 clinics a trimester, that there's going to be multiple preceptors whose eyes have been opened to the equity gaps that exist and that are now going to be motivated and empowered to do something.